Joining me now is Dr. Peter McCullough, epidemiologist, cardiologist, based in Dallas, Texas. Dr. McCullough, now I want to quickly talk about the hurt feelings of the COVID experts who've botched so much from the very beginning. So after 2 years, Dr. McCullough, of them wailing on you and anyone, a lot of us, who questioned a lot of their COVID views, one of the worst offenders, Baylor Dr. Peter Hotez, is very upset at us. Watch.
I had Fox News target me for 2 nights last week, and it's very scary when that happens. This has become part of the new aspect of what the far right has been doing, not only working to discredit the scientists, the science, but actually discrediting individual scientists and going after them. So it's a tough time to be a scientist, as we say.
Yeah, often wrong, never in doubt. What's the lesson they want us to learn here, Doc?
You know, I tell you, I think each and every physician needs to have a great degree of humility. This has been a rapidly developing pandemic over the last 2 years. The information cycle is tremendous. I think Fox has done a great job with its panel of medical advisors that have been true to the data, have cited the data. You just saw what I thought was mass chaos in the prior section of the show, and that it should have been clear once the study showed that the virus was not transmitted asymptomatically. Cow and Madewell showed that the masks should have come off. The randomized trials disproved any effectiveness of masking well people. And what we need to do from this point forward is have a great degree of humility and honesty from our public health officials and those in academia.
Well, Dr. McCullough, so many of them were so horribly wrong and yet so highly pedigreed, yet they continue to stand in positions of power and dismiss and denigrate those who actually were right from the beginning, whether it's about vitamin D3 or therapeutics like ivermectin, the social distancing not really working, spraying your food or your packages. All of it was false. Yet they want to kind of glide along and say, oh, well, you know, things change, science changes, let's just move on. How important is it to look back and get it right and hold people accountable for persistent and almost purposeful errors in judgment, scientific judgment?
You know, there's a term that we use in clinical trials and in data safety monitoring. It's called being responsive to the data. And I wouldn't give high marks for our public health officials and even some in the media in terms of being responsive to the data. It's always humbling to have a rapidly evolving virus and a viral pandemic where there's so many unknowns. And what we need now is we need just a fresh new start where the emergency phase of the pandemic is closed. You see countries now dropping mandates across the board. I think when we drop all the mandates in the United States across the board, it'll become a national holiday.
Dr. McCullough, would you recommend that any child without a pre-existing condition or just any child of decent health get these vaccines at this point? Yes or no?
No. And the data, there's a paper from MMWR, end of December, from the CDC, the safety data, children ages 5 to 11, Laura. It doesn't look good. It looks like the serious conditions for the first time now, we're seeing heart injury in children before puberty. They should not be given under any circumstances.
Dr. McCullough, you've been courageous, brave, and most always right. So thank you so much.